There is a lot of talk about some new procedure about the implant being above and below or a dual plane. Implants placed under the muscle are always dual plane. That has been that way for decades. This is not a new concept, but because it hits the social media, they talk about it like it's the first time it's ever been done. It's been going on like that. I've done it that way for over 20 years now. So what that means is the implant is under the muscle, and that's the only way I do it, and I'll tell you why in a second. But the anatomy of the pectoralis muscle is it comes across the collarbone, down the sternum, and then over to about halfway across the chest, and then it starts to angle up toward the arm. So when the implant's under the muscle, about a third of that implant is sticking out from the muscle. It's not over the muscle, it's just sticking out. It's still under the level of the muscle, but it's outside of that. And that's what that means. There's nothing fantastic about it, that's just the way it is. The reason I like them under the muscle for me, and I tell my patients at this point it's a non-negotiable, is for mammogram surveillance. Implants under the muscle do not interfere with a mammogram. Radiologists tell us as plastic surgeons that if you put the implant above the muscle, up to 15% of breast tissue may not adequately be visualized. Even in today's newest MRI scanners, mammograms, and ultrasounds, you can miss an early cancer with the implant above the muscle. I'm not willing to do that to somebody. There is a big push with colleagues to start putting them above the muscle. That's the reason I don't want to do that, is because I want my patients to have mammograms with good screening. I don't want anybody to come back and say that we missed something because my implant was in the wrong spot. So that's my personal way to do it, and I think it's the right way.